I don't think I've ever been at a time in my career where there has been more of a disconnect between clinical trials and real life. At the end of the day, we look at clinical trials and we say, wow, these results are really good. However, in real life, we know we never achieve them. And we never achieve them because the treatment burden for those clinical trials are so overwhelming. Clearly, there is a need for more than simply anti-VEGF monotherapy. Clearly, there's a disconnect between real life and clinical trials. And clearly, there's still a need to have laser, but not your typical laser that we used to have. What gives Navilas a great opportunity is simply one word. I think we need to have precision. And I think that's what Navilas brings here is precision. I don't think we can do laser the way we used to, where we burnt the retina, where we made very large laser spots, where those laser spots expanded over time. What I think will happen is that we will apply laser not necessarily as photocoagulation, which is to kill cells, but we may actually apply laser as photostimulation. So the precision that I'm talking about is not only in terms of localizing where the laser treatment spots are, but also in selecting the power and the intensity of the treatment spots. I think the way that the Navilas microsecond pulsing will distinguish itself is by the engineering and technical advantages that Navilas already enjoys. So now if you have a precise pattern that's registered, that's navigated, and a precise spot where you can say this is the RPE cell level at this spot, and I'm confident of that, then you've got precision that's three-dimensional, really. And I think that's where the advantage lies. I think there are several characteristics that I saw today that impressed me. Speed is one of those, and this was the fastest PRP that I've really ever done. The screen is right next to me, and all I have to do is, take my finger, point to where I want the pattern to go, press down, and presto, it's there. And I point again, and I point again. And once you get comfortable at this, this becomes really quite easy and quick to do. You point and you press, and you point and you press, and you point and you press, and it almost becomes automatic. At the same time, I'd be holding the contact lens, easily doing this and interacting with the patient.
You doing okay? Everything is going really, really well.
The ability of that lens to get it in the periphery, to me, was also very impressive. There were two things that I learned. Once you start treating and you want to get more peripheral, there are really two ways to do it. One is that you could slide the joystick and you would get really quite peripheral, far enough. But if you really wanted to get even more peripheral, you'd simply have the patient look at a certain way, to one side or another, up, down, right, or left, and by just turning and tilting the lens a little bit combined with the joystick movement, I was very impressed with how peripheral one could get. So after the procedure was done, I rarely, with other conventional lasers, I rarely have to ask the patient anything. The patient is very relieved after the procedure is done. And the first thing they tell me was how painful it was. And when I used the Navilas laser, I asked the patient, was it painful? And universally they said it was very bright in the beginning, but it wasn't painful. I didn't have one patient that said it was painful.
This was awesome. I felt no pain whatsoever. I like it. I like it.
I think the potential to help the practice is great. Now, again, whenever there's technology that comes about, the first thing that we think of is the patient, of course. Is this going to help me better treat the patient? And for the reasons that I've described, I think it has the potential to certainly help me better treat the patient. And then the next thing, obviously, is the economics. If you have a machine where you can get the patients in and out faster, where you can get the patients out of your office without pain and more satisfied, if you can get data collection that can be translated easily into your EMR, where you don't have to have your staff waste time writing things down, typing things, or anything else, absolutely. The flow of patients being smoother is not only more satisfactory to the staff, to me and the patients, but it potentially is a big economic savings as well.